This is Your Health, a podcast of the Integrated Health and Social Services University Network for West Central Montreal.
Hello, I'm Peter Anthony Holder. Welcome to this edition of Your Health. Flu season. It's that time of year again, and it's something the general population should take seriously. Each year, an average of just over 12,000 Canadians are hospitalized with influenza, and there are 3,500 flu-related deaths annually. Here in Quebec, under the flu vaccination program, the flu vaccine is offered free to people who are most at risk of developing serious complications from the flu. Dominique Dufour is the Public Health and Partnership Coordinator for the Integrated Health and Social Services University Network for West Central Montreal. Dominique, first off, please define for us what exactly is the flu.
The flu is an infection of the nose, the throat, and the lungs, and it's caused by two viruses, influenza A and influenza B. And there's the symptoms that we're used to, like sneezing, coughing, fever, that develops with the viruses. It can also go to some complications. So sometimes we can have bronchitis, and people can even have complications to go, and they need to go to the hospital, and it can even cause death.
And are there those who are more vulnerable to needing a flu shot?
Yes, there are people that are more vulnerable. So it's the kids from 6 months to 17 years old that has chronic diseases that should have the flu shot. The pregnant women also on their third or second trimester. All the adults that have chronic illness like diabetes or emphysema. And also all the people that are 75 years old and older. It is also to reduce the risks for the other population. We recommend that the workers in the health system get the flu shot, and the people that will live with very young kids, like 6 months and under, or people that are already at risk. Those people living with them should get the flu shot. This year, we're equally going to give the vaccination free to the people that had it last year, that's free this year.
Is there someone who shouldn't be getting a flu shot for whatever reason?
Well, you don't have to get the flu shot if you're in good health. But if you're in good health and you know people that are 75 and older and you see them often, or you live with a kid that's very, very young, it's recommended that you get it. But if you just you're really in good health and you don't see people that are more vulnerable to the flu, you don't need it because you won't get the complications of the flu.
Are there any side effects that one has to be concerned with when getting a flu shot?
You can get a few side effects. Sometimes you could be sore on your arm where you get the vaccination. And also some people can develop a few small symptoms of the flu because your system is working on defending itself with the vaccination. So sometimes you can get for 24 hours after the vaccine a few symptoms, but it's really mild.
And what if you get the flu even after getting a vaccination?
Well, the vaccine is really made with the three viruses that are considered to be the worst one coming to North America during the winter. So if you get the flu after you get vaccinated, it's because it's another strain of a virus. So they can be maybe, I don't know, a few viruses that are going around in the world, and we're immune to the three worst, but we can get the fourth one or the fifth one.
And let's go on that assumption that someone gets that fourth virus. Having had the vaccine and you're still susceptible to that other flu, does it in any way, shape, or form lessen the severity of it should you get a flu?
Well, some doctors say that yes, that it's going to help you defend a little more against that virus, and you're going to get a little less symptoms of the flu.
I know in the past there's been some concern over the years that there wouldn't be enough flu shots to go around. I take it that's not going to be a problem?
No, this year we were really advised by the Direction Régionale of Public Health that we had enough vaccination for all Quebec citizens that need the shot. I hope we get comments on the appointment that we give this year, since it's new for us to give the flu shot on appointment, and the quality of the services really increases.
Tell us once again about the appointment and how one can get their flu shots this time around.
So you can take an appointment by intranet. So you can go on monvaccin.ca or clicsante.ca, and you choose the CIUS Centre-Ouest of Montreal, and then you choose the CLSC where you want to get your flu shot, and the calendar will open for you, and you can choose the moment that's good for you. Or you can always call at your CLSC and ask for an appointment for the flu shot, and they'll transfer you to the person that's going to give the appointment for you.
That was Dominique Dufour, the Public Health and Partnership Coordinator for the Integrated Health and Social Services University Network for West Central Montreal. For more information about how you can get your flu shot, go online to clicsante.ca. That's clicsante.ca. And that's it for this edition of Your Health. Again, we remind you, if you missed any of our previous programs, you can find them archived on our website at podcast.ciuswestcentral.ca. That's podcast.ciuswestcentral.ca. You'll find there all the information such as links or phone numbers that we've mentioned on the show. Also, feel free to drop us a line if there is a topic or area of discussion that you'd like us to explore on future programs. I'm Peter Anthony Holder. Thanks for joining us.
You've been listening to Your Health, a podcast of the Integrated Health and Social Services University Network for West Central Montreal. Join us next week for another edition of Your Health.